Depression is a debilitating and complex disease. It affects every age, young and old, every gender and every facet of our society. In our effort to understand and treat depression, we must first begin with a proper diagnosis.
The diagnosis of the depression is very different for every patient. Patients are coming with different questions, and usually they are coming to our office after they were treated by usually primary physician, and their symptoms cannot get under control.
In order to properly diagnose an individual with depression, one must take into account the various symptoms that could be a sign for the onset of depression.
Depression is a whole illness of the whole cluster of symptoms. It isn't just when people have a bad day. We look at things like how people are sleeping, how they're eating, how they're thinking, if they're thinking a lot about death, if they're feeling worthless and hopeless, if they're concentrating well or having difficulties with concentration. That's another sign of depression. Sometimes people notice that they don't sleep as well, or they sleep too much, they lose appetite, they sometimes have sexual difficulties, they may notice they have more pain. So we go through a whole bunch of symptoms looking at how people function in their lives, if they have pleasure in activities, or if they're feeling like nothing gives them pleasure anymore. So we can do this for a variety of ways. We can look at a certain task that they fill out that shows the symptoms, or a lot of times we'll just look at the symptoms and say, tell me about your sleep. Tell me about how your appetite is. Tell me about how you're doing with concentration. How are you functioning at work? Do you have pleasure in your activities? What are your thoughts lately? What kinds of things are you thinking about? And it's through those patterns that we're able to determine if someone's really suffering from a serious depression.
Mood swings, an overwhelming feeling of loss, a lack of appetite or lack of energy are all signs of depression, but perhaps none more important than the feelings of anxiety.
I try to make it very simplified for the patient to understand. Mainly the depression could be the changes of the mood, that the people explain that they down, they're teary, they cry a lot, they don't get out of their bed. Occasionally they feel the anxiety and irritability. They talk about their sleeping, could be a lot of sleeping versus not sleeping at all. At the same time, they don't have an appetite and they don't have energy. These are all could be part of the depression. But a lot of people nowadays that I see come with a lot of anxiety, and they consider that the severe depression also.
Within the process of diagnosis, one must consider the various medical issues that may be causing or contributing to the symptoms of depression.
Most of chronic illnesses that we encounter in the office is they could come with the depression, specifically cardiac, and some people with the stroke that we treat for depression. And to my experience, what we do for the patient, 65% the medication can help them and improve their situation. That's what we hope they improve their coping skills. And together they can help the patient a lot, that at least they become more hopeful. and they don't go usually through the day with a lot of grief or sadness. I do see the improvement in the chronic illnesses when they've been treated with the depression.
Proper testing can provide powerful insights in the diagnosis of depression by encompassing the many medical factors involved.
People have low levels of things like vitamin D or vitamin B12 that can cause depression, and also sometimes we'll check to see if people have enough iron in their blood or red blood cells. If there's some anemia, that can cause depression. There are certain pain conditions that are comorbid or connected to depression. There's a lot of medical conditions that can cause depression.
Family history is another vital aspect in the diagnosis of depression. A person's genetic inheritance and genetic makeup may cause them to be predisposed to the condition. When treating an individual with depression, this information becomes valuable.
In psychiatry, we're concerned about the genetic a lot. In depression, yes, usually one of the questions that we ask is the history of the family, that if there is a depression, the person is more predisposed to experience that. And unfortunately, a lot of these populations with depression, the environment has a lot of effect. The people start self-medicating, especially now when they're younger, and this adds to their mood changes. And they become more resistant to the medication that we usually use. So the answer is yes. If the people have a depression, their family could have a major effect in the patient's symptoms.
Depression is unbiased in its quest for victims. And although it affects every level of our society, it has been found to occur more often in certain individuals.
Anybody can have depression, but women are, in my understanding, twice as likely during their reproductive years to suffer depression as men. People in their older years sometimes can be more predisposed to depression. Teenagers are predisposed. The truth is, any gender, any age, any class, any race, any person could be potentially predisposed to depression. Oftentimes, people will become depressed because of a certain situation, a divorce, a loss of job, or a loss of a significant person in their lives, or pet, or something like that. Other times, people just become depressed, and what we find is there are people who are genetically predisposed, meaning that their family also has a history of depression, and that person is just sort of genetically set up to become depressed at various times. And so there doesn't have to be a specific situation that leads to depression. Sometimes it just comes on its own accord for no clear reason.
Nonetheless, depression is wide in its reach, and this mysterious disease does not discriminate between the old or young.
Is any age, a specific age, develop the depression? No, depression or mental illness can be seen in any ages. Start from age of 4 years old, at least that I know, and go on to age of 90 at least. Yes, you can see it in any stratum of the society, any age.
Depression is a complex and destructive disease, but it is still a treatable disease. And for the many who suffer from depression, there is still